Hi everyone, my name's Maddie. This is my first ever video. I'm making this because I'm going through a big life decision and I'm trying to come to terms with the big decision that I'm making, which is whether to have double jaw surgery on my lower jaw to correct my overbite and all the other things that come along with that, so braces and potentially another surgery, which I'll kind of go into the details of in a minute. But I found that there's a lot of people on YouTube who've gone through this and have made videos, you know, even documenting their whole surgery process, and those have been so helpful to me in helping me understand my options and helping me to understand what the process is like. And so I just wanted to make something explaining where I am, how I'm making my decision, and documenting that right from the beginning, to see whether, you know, I could get some wisdom from you guys, from the internet as a whole, or whether perhaps this video might help someone else who's going through the same decision. So I'll tell you a little bit about my background with my teeth and my jaw, and also then go through kind of what surgeries have been suggested to me, proposed to me, and then what the reasons are that I do think I might do it, and also some of the things that are the risks and the concerns and the reasons why I'm a bit anxious about it in some ways. I haven't made any final decisions yet, but I am getting to the point where I'm feeling pretty confident about doing the surgery. And yeah, I'm hoping that this will help me process, but also perhaps help other people. So a little bit about me. When I was a teenager, I, like many people, went to the orthodontist and was suggested braces, and at the time, obviously, I went with my family, with my parents, and we were recommended all sorts of things. My overbite was quite strong even back then, and I believe there was mentions of surgery at the time. There was also mentions of head braces and all sorts of things. And I think we saw several different orthodontists, and, you know, treatment suggestions can be quite different when you speak to different people. But essentially my parents were not particularly fond of the idea of their kind of precious daughter going through all this stuff as a teenager in those kind of formative years. And so in the end we opted just to have a simple set of braces on my top teeth only. My bottom ones aren't completely straight, but there was nothing particularly wrong with them, whereas the top ones, I had two teeth here that stuck out quite a lot. So all we did was have braces to bring those back into place, and I didn't actually have them for very long in the end. Obviously, like so many people, when I went off to university at the age of 18 and going into adulthood, I just stopped wearing my retainer. I did have a fixed wire retainer holding the front 4 teeth in place, but I was also meant to wear a nightly retainer, you know, essentially every night, or at least every other night for the rest of my life. And I remember at the time thinking, God, there's no way I'll be wearing this for the rest of my life. It just didn't seem like a practical thing to be doing. But I did try for a while, and yeah, as I went to uni, maybe I started wearing it maybe once a week when I remembered, and then by the time I was like, oh, well, now I have a boyfriend, I'm not going to be wearing the retainer when I'm going to sleep at his, like, well, that's crazy. And so I didn't take it that seriously, and my teeth slipped a little to the point where it became painful to wear it, and so I wore it less and less and less. By the time I was, I don't know, 25 or so, I just wasn't wearing it at all. It had completely not become a part of my routine. Hold on, gotta have a sip of tea. Can't do this without tea. So it got even worse because the wire retainer that I mentioned that's behind my front 4 teeth, that actually broke. I remember a little piece of the thing that's keeping it in place, the kind of glue, I guess, chipping away one day. I mean, I thought, oh no, what's gone on here? Maybe I should go to somebody. But I didn't even have an orthodontist at that point. I didn't have anyone that I could go to with that problem, and I just thought, oh, if I ignore it, maybe it'll be fine. And it wasn't fine. More of the glue came away, and now my tooth on the right here, the second one along, is been pulled very much in. So the bit that was fixed pulled on the tooth where the glue had broken. If you don't like looking at teeth, then just skip this bit, but you can see this tooth here has kind of been pulled right back, and it's right at an angle. And also I think that not wearing the retainer, they've kind of shifted more closer together and that overbite has become more prominent. So with lockdown, and I've been working from home pretty much for a year now, well, over a year, I had a bit more time in a way to think about this, and I was able to get an appointment with an orthodontist who's just down the road, and it was very much easier to do that when I was at home and could just take, an hour out of my normal working day and just work a little bit longer that day at home. So I went along to an orthodontist and they said, well, of course we can think about orthodontics to bring that one tooth back, to kind of correct some of the others that have shifted out of place. But really, if you're serious about this long term and you want to really correct your issues for the long term, would you consider surgery? And it was kind of what I was expecting him to say. I kind of knew that would be the answer, because over the years I have known that my overbite was so strong that kind of any in-betweeny orthodontics is not going to really fix the problem. I've known that this was a treatment that was often offered to people with overbites like mine. I wasn't particularly surprised when they said that, and so I said, yeah, sure, I would be happy to be referred to a surgeon to talk through what that might look like. So I was referred to a surgeon, and I might do a different video maybe going into the details of what all the surgeries are that I've been suggested that would be suitable for me. But the couple of things. Firstly, my palate on the top jaw is very narrow. So in order to create a kind of symmetrical bite, they would need to expand the top palate, and that's done with a surgery called SAPI, surgically assisted rapid palatal expansion, which kind of sounds actually kind of gross, this surgery, but they basically cut down the middle of your top palate and then use an expander to, over time, you have to wear it every day, it's fixed in your teeth, and you kind of wind this thing to expand your palate. So that's surgery number one. Then I would need, as my palate expands, it would leave a gap in the middle of my front two teeth because they're being pulled apart by the expander. Then I would need orthodontics braces to bring that gap back, to fix all the overcrowding and create the nice straight teeth. And I'd also do it on the bottom to match. And this is all in preparation to then have double jaw surgery. So both my top and my lower jaw would be brought forward surgically, and that would happen after the braces, so maybe in a year or a year and a half, however long the braces take to get you to the point where your teeth are aligned. That's what's been proposed to me, and that's what I'm deciding about doing. Now it's just down to how to make that decision. So obviously the main reason why I was thinking about the surgery in the first place was to do with my teeth. So, reason number one is my teeth, my bite is just, it's quite extreme. If I go to the side, I wonder if you can see, there's quite a big gap between where my top teeth and my bottom teeth meet. So when I bite, when I eat food, those teeth are just never hitting each other. It actually makes for some kind of silly ways that I eat food, and those ways are not particularly very good for my teeth because I'm kind of pushing them around in my mouth in a kind of unnatural way. And also, all my chewing and my biting is done by my back teeth. They're the only ones that meet. So they are wearing away at an incredible rate. They're so flat already. And I'm only 30, actually just turned 30 a couple of days ago. But they're so flat because they're taking all of the pressure of all of my biting all the time. And also because my jaw is not in the right place. I kind of grind them a lot because it's just not sitting right. I know a lot of people grind their teeth, but you know, it's one of the many reasons why my teeth are so flat. So yeah, the kind of the fixing of that bite could be really important for my health of my teeth, or kind of on an ongoing lifetime basis. Other reasons that are actually really interesting to have learnt about since talking to the surgeon. So my breathing is actually quite badly impaired by both the upper and the lower jaw being set back. So first of all, I snore quite badly, which my partner will tell you. Yeah, I mean, everyone that I've ever been with, like as a teenager on a sleepover or staying somewhere, knows that I snore. And you know, it's not the worst snoring in the world, but it's worse than most people. Not just the occasional thing. And the reason is that you could see it on my x-ray, which maybe I'll be able to get up here somewhere. The reason is that this lower jaw here is so set back that it's actually restricting the airway. So when I lie on my back, or even lie down in general, or just as I'm going around my day, it is putting pressure on that airway there, and so it's restricted, and so I snore. And although the snoring is not so much of an issue right now, I think it does affect my sleep. I do wake up sometimes, or I'm woken up by my partner, and that's not the best, especially in these times when everyone's stressed and sleep is a bit difficult anyway. But it's also potentially could get worse over time. So snoring tends to get worse as you get older, if you put on weight or if you get pregnant. And if it did get worse, it's potentially, I'm kind of at this borderline level of being close to being eligible to go for a sleep study, and you know, potentially find out if I might develop sleep apnea, where you actually stop breathing in your sleep and then you kind of jolt and wake up, and that can really disturb people's sleep patterns. And sleep is so important for your general well-being and your general health. So that's one way in which my breathing is affected by my jaw. But actually my nasal cavities are also affected, because this upper jaw is not supporting the muscles in my face and my nose. And I've always had trouble breathing through my nose. I've actually gotten better since I've started doing yoga, because yoga forces you to breathe through your nose. You must practice breathing through your nose. But it is harder for me than for most people. I think even as a kid, there was potentially thought that I might have had asthma, but I didn't. It's just that my nasal cavities aren't supported by the muscles, so it's harder for me to breathe through my nose in general. Oh, just thinking about it now. Those are some quite kind of serious medical reasons why double jaw surgery would be good for me. And obviously the others are cosmetic reasons. I find it kind of strange to talk about the cosmetic side, because I don't know whether I would do it if it was just for the cosmetics, but I actually think that the cosmetic side and the medical side are all interlinked, and it's not really one or the other, it's both, and they can't really be separated. But I've always been kind of self-conscious about my chin, or lack thereof, and my jaw. I always, you know, think that in pictures I've always got a double chin, even though I'm not overweight. You know, I feel that it makes me look like I have a double chin way more often than I ought to. And from the side, obviously, I just don't have any kind of jawline. It's just, that was actually me pulling it out there. If I sit completely straight, there's just nothing, which is something I have been self-conscious of. I don't go around feeling self-conscious. I'm not unconfident as a person. I have always been confident, and I certainly throughout my 20s have felt good about myself and good about how I look and present myself on a day-to-day basis. It doesn't affect me as I'm going about my life, but there are moments and there are kind of things in the back of my mind that I think have always been there. I kind of have always had this, like, it feels like a knowledge, not a belief, like a piece of knowledge that, like, my face is unattractive in a kind of like not in a subjective way, in like an objective way, in a, like, if you were drawing an attractive face, it would have strong jawline and strong cheekbones and a chin and prominent, and those features are, even when we're not talking about, you know, attractive bodies, but when we just think about people's faces and what's an attractive face, those things are just almost given as, like, fundamental. And people that, you know, people like me that don't have that, it feels like, well, obviously I have an unattractive face, and it doesn't emotionally affect the way I go about in the world, I don't think, but it is a belief that I have about myself. And so I don't think that I would do it if it was only the cosmetic reasons, but the cosmetic reasons are there, if that makes sense. Then there's some other things that are actually really interesting that I only learned about having talked to a couple of different surgeons, actually, and that's that bringing both the jaws forward actually supports the facial muscles, like I was talking about with the breathing, but it also affects the way that your face shape works. So it would bring up my cheeks a little bit because the top jaw would be supporting those muscles there. And also, interestingly, I've always had this bumpy nose, which I don't mind too much. I know some people really hate it, but it does kind of go down like this and come down a bit. There we go. If the facial muscles were better supported, it's actually true that the nose would be better supported. So obviously nothing's going to change about my bump, but let me just do this experiment for you. Did you see a change in the shape of my nose? I can't see whether it's coming out right or not, but basically, as you push the cheekbones up and support them more, which the top jaw would do a little bit, the shape of the nose does change a little. And also the widening of this palate would also widen my nose slightly. It's quite thin. I think it's all related. So those are more like side effects of things that might happen rather than reasons to do it. But I do find it fascinating that this interconnectedness of the cosmetic side and the medical side is all linked and all related, and none of it can really be taken apart from each other. The last reason I kind of wanted to mention is more kind of an emotional response and an emotional reason that I'm seriously considering it. And it's almost that I feel like this is something that I should have had fixed as a teenager and didn't. And by waiting longer or by not doing it, I'm just always going to regret it. I just feel like it's something I need to do. I feel like it's just what I should have done, and it's what I want to do, and I will regret it if I don't do it. I said to my partner the other day, as it was all kind of, you know, getting closer to making the decision, I almost feel excited about it, which is a weird thing to say because it's such a big deal and it's quite scary and there's lots of gross things about it, which I'll go into in a minute. But I actually almost feel excited to get this done because it has been something that's been on my mind for so long and it's been a part of my life for so long. So I do almost feel kind of excited about it. Now to talk about the less glamorous parts and the more kind of disgusting or scary parts. So what are the reasons why I might choose not to do it, or what are the things that I've been considering as concerns and risks? So obviously there's the kind of major medical risks of surgery. It is a big operation. The first one, the SAPI surgery, would be just a single night in hospital, but the second one could be up to 3 nights in hospital and has kind of weeks and weeks of recovery time necessary. So particularly that second one is a really big deal surgery to be doing. Both of them would be under general anaesthetic. So there's all the risks of general anaesthetic having a reaction to it, other risks of surgery like severe bleeding, and needing a blood transfusion, anything like that. Taking on something like a big surgery is not something to be taken lightly and just done because you want to do it. It needs to be thought through and taken seriously, and you need to know that the benefits you're going to gain from it outweigh those risks. So then there's the risks of the specific surgeries that I'm talking about. So with the SAPI surgery, there are kind of risks of things going wrong with maybe the palate flattening out or not taking quite the right way. I actually know less about the risks of that surgery because I've been more focusing on the risks of the big double jaw surgery, which, as I say, is a bigger operation. One of the very, very common side effects, and happens to most people at least temporarily, is that they get numbness around their face or their chin or their mouth, and that can actually be permanent in some cases, normally only in a small area, and normally not to the extent that most people worry about it, but that is a possibility that you could end up with numbness around your mouth, and you almost certainly will after the surgery immediately. That's a kind of common side effect that you have to think about whether that's a worry to you or not. Another side effect that has been mentioned to me a couple of times is this post-operative condylar resorption. So this is when I believe the kind of joint at the back of your jaw where you've had to cut into this jaw, the joint here doesn't react well and it starts to kind of resorb back. And so the way that you've moved the jaw forward would actually then start to recede back again. Now apparently this is quite uncommon and shouldn't be something that I needed to be worried about. I was told I wasn't in the risk group for it, which I think was to do with the size of your joint here and whether you get clicking in your joints very often. So I was told I wasn't in the risk group for it, but it can happen. And so that means that, you've had the surgery to bring it forward and then it can go back because some of this resorbs. I know it's completely the wrong terminology, I'm sure. One of the surgeons I saw actually said they've only had one case, and in that case it didn't end up going back as much as it had been brought forward, if that makes sense. So the recession back wasn't as bad as they had originally been, and so they didn't end up doing anything about it, but you could choose to do something more about it afterwards if you wanted to. Another thing that has been slightly concerning me, and probably will affect me a little bit, is the effects of having braces again. I actually have on my two, I guess these are the canines, third ones along, the kind of fang ones. I have some receding gums there, and I've been told that that's most likely because of the fact that I had braces as a teenager, and any movement of teeth, if you've got weaker gums, can mean that the gums recede. And so it is quite likely that by having braces again and moving the teeth around quite a lot, maybe, that I might end up with more receding gums, which is a slight concern actually, but hopefully can be managed, and there are treatments for that later in life as well. So those are kind of some of the medical risks that I'm potentially going to be taking on. The other big kind of concern is around cost. So I'm in the UK, obviously we have the NHS, and it is possible that I could get this surgery on the NHS. I was told by one of the surgeons that my case is severe enough that the NHS would treat it in theory, but different trusts, different areas of the country sometimes only allow for double jaw surgery, for jaw surgery in general, up to a certain age. So that might be just for teenagers, or it could be up to 25 or 29 or whatever. But different trusts will act slightly differently and make those decisions slightly differently. I've actually been looking, at the moment I've just been looking privately, but could consider getting referred to an NHS surgeon and orthodontist. However, I was warned that it can take a long time on the NHS. So with a private surgeon and orthodontist, I could basically get on with it and just get an appointment when I want and book surgeries, and I can kind of get on with it at my own speed. Whereas, I was told to expect that with the NHS, the whole process could take up to 4 years, and I have already spent 6 months or so thinking about this and talking to people. If I do go down the private route, it's an expensive surgery. So obviously there's the first surgery, the cost of that, then there's the cost of the braces, and then there's the cost of the second surgery, the larger surgery, and that is quite a significant cost. That's one aspect. Then the other concern is really just the ongoing kind of pain of braces and pain of recoveries from surgeries and the kind of uncomfortableness of all that. There's obviously braces can be quite a pain and they're not very nice to look at, and they can, your gums can get all rubbed up against and all that stuff that I remember from being a teenager. I've obviously got to keep them extremely clean and keep them extremely healthy, keep my teeth healthy, and that's going to involve a lot of maintenance and a lot of, every day, every night, making sure I'm keeping them really well. There's the pain of the expander I talked about in bringing my palate wider. That sits on your two teeth here, and then there's a little plate, well, quite a big plate actually, in the middle that you then turn a key in it every day or however many times a day you're told, and that pulls your palate apart. But it's this metal thing that's like right in the middle of your mouth, and I think it's quite uncomfortable to eat, get food stuck in it and stuff, and that's going to be a not particularly pleasant process. It's also going to leave me with a massive gap in the middle of my teeth. I've seen some of them where like it's bigger than the size of a single tooth. It's really wide. It's not like a cute little tooth gap. It's like it's like witch territory, which I can put up with for a while. Then there's kind of the recovery from the two different surgeries. Have to have someone looking after me. I have a fiance. We're getting married next year. So he would have to make sure he's got the time to take off work to look after me. Would have to be on a liquid diet for quite a while. I would get a lot of swelling in my face, particularly from that second surgery that takes a long time to go down. And yeah, I think it's not a very nice thing to recover from. I've been told that the surgery itself isn't that bad because you're under general anaesthetic and there's local anaesthetic around the mouth, so even when you wake up it's not too painful. But I think it's going to be pretty uncomfortable, and you can have blood in your mouth and in your nose, and sounds pretty horrible. So that's something to work out whether I'm mentally prepared for that. And then there's long-term recovery. The results might take a long time to see because you can be swollen for very long time. Some of the YouTube videos I've watched, people have said, oh, well, I'll come back 2 years later and I actually do look different even than 6 months after the surgery. It can take a long time to see full results. And you've got to make sure that you look after your jaw and look after your face and things long term. Keep wearing those retainers, which I will absolutely do this time. I'm going to have to do that basically for the rest of my life. And lastly, I mentioned that I'm getting married in a year. Is this quite the right time to be doing this? I don't know. It's likely that the second surgery would be after the wedding, which means I would be in braces for the wedding. Whether they can take them off for a bit, maybe. We'll see. But also just with the stress of planning a wedding and all of the fun of doing that, do I want to be bringing in this extra complication into our lives right now? I don't know. And then lastly, I think the other thing is just the kind of not knowing what my face will look like afterwards. Obviously, part of the point is that, it's improving things about myself. But I will look like a different person. Some of the pictures that I've seen of the results are incredible, but you would hardly recognize them as the same person. And I think that that might be quite hard, not just for myself, but maybe for other people. So, my partner, my parents, my family, how will they cope with my face being different? How will I cope with my face being different? I know sometimes people are referred to therapists or psychologists to talk through that stuff, because you can have a bit of a weird reaction to seeing yourself in a completely different way. So yeah, that's really something to think about. And they can't really do reconstructions or predictions of what you're going to look like with this kind of surgery, because it's so fundamental to your whole facial structure. It's really hard to predict how moving these things would affect all the muscles in your face, and therefore how you're going to look. So it's not like with, say, a nose job or something where they can just show you what it might look like. That's just not possible. So I won't know what the results are until I see them, which is kind of strange. So I think that kind of sums up where I am. I've talked to my original orthodontist, who referred me to his surgeon that he works with, and I've also talked to a different orthodontist about perhaps the idea of just working with the teeth, or what could we do if we didn't do jaw surgery. And I've also talked to a separate jaw surgeon just to get a different opinion, which I think was really good, to get an idea of whether they would have recommended the same treatments or not, and they pretty much did. Everyone obviously has a different approach to these things. So that's that. I'm still making my decision, but I think I am pretty close to being happy with going ahead. And as I said, I kind of feel excited about it, which I think is a good sign. I'll let you know. If you have any thoughts or any kind of experiences that you'd like to share with me, or that might help me make this decision, or anything that you'd like me to think about that I haven't thought about yet, then please do leave messages for me in the comments, and I'd love to hear from you. Thank you so much. Bye.